Good evening, everyone. My name's Dr. David Garley, doctor from the Better Sleep Clinic. So I'm director of the Better Sleep Clinic. We are a clinic that see a variety of different sleep disorders. On a one-to-one basis, it's mainly sleep apnea and insomnia and some sleep disorders that arise out of shift work. But we also work with specific groups of people, and one of those is athletes. And we work with athletes mainly because sleep is a large component of fitness and performance, which we'll be talking about today. And with me, we have Dr. Luke Gupta, who has an awful lot of experience working in sleep in an athletic context. And Luke, I don't know if you want to tell us a bit about yourself and your experiences working in this area.
Yes, of course. Hi, everyone. So I've worked in high performance sport for about coming up 15 years. And I've specialised in the topic of sleep and recovery for about 10 of those. So during that time, I've sort of seen quite a big shift in how sleep operates really in the context of high performance sport. Firstly, starting off as a fairly novel and new topic and something that people don't really know how to work with. It was quite a new kid on the block as such, particularly in the context of recovery. But now it's kind of grown into this sort of huge topic and area of interest where lots of professional sport teams and other sports across the globe really are starting to really pay attention to sleep and starting to make it part of their practice in terms of how they monitor sleep, how they measure it, and how they manage it. So yeah, I've sort of had the privilege really of sort of being a bystander to that, but also being an active researcher in the start of my career, and now I'm a practitioner who works with lots of different athletes through the Better Sleep Clinic. We'll speak more about that a bit later on.
Brilliant. And so it's true, isn't it, that sleep is a bit of a new kid on the block when it comes to fitness, and it's true that people are taking it more seriously. But what do you think is really driving that interest, that increase in interest in sleep?
I think it's a bit of a how's the best way to put this? I think there's probably two areas, really, two things that are going on. One, there's this real familiarity with sleep, so everyone experiences it, everyone does it, so everyone's got their own sort of their own practices, their own sort of way which they sleep, and that's something which is very human and something that everyone can sort of speak to. But when you put that into a high performance sport context, there's also this acknowledgement that sleep delivers quite a lot. We know that from lots of different contexts from outside of sport, but in sport, we know that it delivers at many levels for athletes because they are human at the end of the day. So we speak about sleep in terms of it preparing athletes for performance. We speak about it in terms of recovering athletes from performance. We speak about it more recently in context of health and mental health and just general well-being. So it's quite rare you see a topic like sleep that really infiltrates sort of every part of being human. And that's kind of very much how it is dealt with in sport, not in those terms. It's sort of compartmentalized and they slap a banner on it that makes it sound a lot more attractive than that. But essentially it's something which is really familiar with people and something where it's acknowledged now that it does deliver a lot for athletes.
Yeah, that's certainly our kind of experience of working with, probably sort of down from a kind of organizational level with sport, but on the sort of the level of personal trainers, that there's often a lot of understanding of things like training and nutrition, but actually sleep it's unusual that the understanding of this isn't quite on par. And what I'm talking about here is that there's the triad of fitness, the triad of performance, which is training, nutrition, and sleep. But sleep, at the same time as being something that is innately familiar to someone, at the same time is not as well understood. And I know that we've been doing quite a lot of work on trying to increase the kind of the general understanding of sleep. One of the first points you mentioned was actually performance. How do you feel that sleep impacts performance on an athletic sense?
I think this is a topic which is one which is quite assumed. So I think it's very easy, and I think it's quite overstated that there's almost like this linear cause and effect with sleep and performance, whereby if you don't sleep well, you're not going to be able to perform well. But we kind of know now more so, and a lot of the work that me and Dave have done sort of brought that to life much more recently, is that there's like almost a bi-directional relationship between sleep and performance, whereby we know that sleep can have an impact on performance, but it may not be so direct. There'd be other sort of components of fitness and performance that it have a greater effect on than others, but nonetheless it does have an impact, albeit not direct. And then we know that just by an athlete, but particularly at the elite level, just by being an elite athlete and trying to meet the demands of that frequent travels, frequent competition, sort of daily training, all those demands placed on an athlete as one layer, and then just the demands of life on top of that can have like an inverted effect whereby that has an impact on sleep. So it's not a simple one-way relationship, it's two-way. And I think it's important to acknowledge that and consider that sometimes treating it as one way can be quite limited, and embracing that complexity is a great way to start, because you start to understand all the different factors that are at play here, because like any topic, nothing's simple. But I know we've had experiences, Dave, when we're working with professional football clubs where we're trying to educate athletes or football players around this topic of sleep and performance. And it's always our first entry point is, can you please come in and talk to us about how sleep impacts performance, because that's what people want to know. But when you actually dial down to like athletes' experiences of this, they all know this. They all know that it's like almost matter of fact, and that's delivered in two ways. One is what they know from what they sort of read, listen to, and see through various sources of information, but also through their subjective experiences of playing or competing. We know that many athletes are able to and do deliver high levels of performance on very little sleep. So sometimes those narratives don't quite play out as people expect to, and that's kind of how it works in reality.
Yeah, and it's similar actually to other aspects of our clinics work when we're working with people with insomnia. So insomnia is interesting because one of the key factors that perpetuates insomnia is the fear about how you're going to function if you haven't slept well. And the bottom line basically is that you can always perform better, you can always do quite well, even if you haven't slept as well as you would like. And this is the interesting perspective of a sleep clinic. It's basically the sleep clinic paradox, because we're trying to encourage people to take sleep seriously, and you want to promote sleep, but at the same time you don't want to overdo it, because at the same time you actually have to take sleep down from a pedestal, because if you worry too much about sleep, worry, concern, anxiety would be the three opponents of sleep, the three things that will stop you sleeping. And we see this a lot in a competition setting. So I know, Luke, you've worked quite a lot with the Olympic team, and if you know any Olympians or Olympians or follow them, that actually they start training towards an Olympic Games really early on. It could be like 2 Olympic cycles earlier than it actually takes place. And as you get closer to the Olympics, you get selection, you do the extra training, you get closer and closer, and it gets closer to the thing that you're primarily worried about, and it drives up your worry and anxiety, and this actually stops you sleeping. And as a result of not sleeping, you can then feel like you're not having that correct athletic mindset to keep you going, and this can gather momentum. And a lot of the work we do is actually helping people understand the mechanics of sleep. And if you understand that, you can almost expect that your sleep is going to get disrupted around race season. You can anticipate it, and when you know that it's coming, you actually feel more in control of it, and that actually makes the whole situation slightly less anxiety provoking, slightly less bothersome. What about recovery, Luke? That's another, you mentioned that earlier as one area that you did quite a lot of research in. What would you say sleep's impact on recovery is?
Yeah, so this is the other side of the coin, really. So yeah, I think sleep gets treated in different ways when you talk about recovery. One is it's like almost spoken about as it's a tool, and that sort of follows lots of current narratives that are present in that recovery space, whereby a lot of recovery is very tool led. So by that I mean people or support teams, whoever really, kind of gravitate to things and tools they can use to sort of accelerate the need for recovery. And as you sort of move up that performance pyramid to sort of the elite level, we know that the demands placed on athletes are so much greater in terms of the frequency of training, competition, and travel, that those windows for recovery get shorter and shorter. And when you start talking about Premier League football or even sort of like other forms of sport in different countries, that the congestion of fixtures that are demanded on sort of athletes is just growing and growing, and those windows of recovery are getting smaller and smaller. So what that means is you get much more of an emphasis on some of the basics, and we always talk about doing the basics well as part of like a fundamental approach to recovery. And usually within that, you've got sleep, rest, and nutrition. And sleep gets branded as this like one of the best things you can do for recovery is sleep well. But that doesn't always mean that it plays out like that, because sleep is also something that in itself needs to be recovered. So because it is part of someone's performance in a way that it prepares them, it facilitates their ability to perform, but also through the challenges of things like playing at night, as Dave alluded to, sort of that anxiety and worry before matches and competitions, it can chip away at sleep as well. So that in itself needs to be recovered. So that's like an approach to recovery. But there are some sort of the reasons why it gets put like quite high up the agenda and something to be prioritized when we talk about recovery, is because, like I said before, it does deliver a lot. And we know that sleep in itself is by nature restorative, and we lean on that, and we use sleep as a vehicle to recover. And lots of really beneficial stuff happens for recovery during sleep, and we know it sort of plays a role in sort of our metabolism, our immune response, our muscle regrowth and repair after sort of like intense competition and training. But all that is there in sleep, and just because it's there in sleep doesn't mean that it's something to pay attention to. So what I'm trying to say here is that sleep is quite unique compared to other forms of recovery, if you want to compare that, because we know that these things aren't voluntary. And this kind of speaks a little bit to the mechanics of sleep. So when we're talking about sleep and recovery, we always place an emphasis that it's important to do it well, particularly after really challenging sort of periods of competition or training. But these things don't just come naturally, unfortunately, because you can create a bit of a paradox whereby a lot of emphasis is placed on getting good sleep for recovery. But if it's literally just happen, if you want to get that right after the performance, where usually people want to get it the most, it tends to fall down quite quickly. You create this paradox of really wanting to sleep well, but just because of the challenges and the circumstances which someone's in means it doesn't happen readily, leading to sort of basically poor sleep. So we try to make people aware of this. We work with sports teams as well to try and how do you program an approach to sleep in the context of recovery, whereby we can increase the likelihood that sleep is better, not all the time, but you kind of can manage it and approach it in a way which feels quite normal to athletes, and something that's not expected to be like the best it can be all the time. So that's quite a waffly answer, Dave. Sorry, but it's I think it's quite an important one to walk around, because it does get treated quite simply, I think, as in it is this, but it's much more complicated than that. And I think it's important to acknowledge that, and it's important to understand that. And that's a lot of what we do at the Better Sleep Clinic here, is sort of educate people on the role of sleep and recovery and how you can approach that and accommodate that into other forms of recovery. Because yes, sleep is a form of recovery, it's a vehicle for recovery, but it's not the only component. Like, for example, if you just slept loads and didn't eat very much, you would still be under recovered in some regards. So it's a balancing act, really.
Yeah, I completely agree. So education's key. I think without understanding the mechanics and all the aspects of recovery, that you do end up inevitably with too much of an emphasis on this. And this played out recently. We were working with a marathon runner who had a good emphasis on the role of sleep for recovery. But we were talking about the adaptability of sleep, and that if you are training a lot, that your sleep need will go up and your body's ability to sleep will improve in a simplistic way. But actually in the acute phase after a marathon or a huge amount of training, your sleep actually can be disrupted. And that doesn't often make sense to people, that if sleep is for recovery, then why is my sleep disrupted after a marathon? But then there are all the other components of recovery that are taking place. So there's the rehydration, there's the nutrition, and that itself can disrupt sleep. And there's the more physical aspects of recovery that your body's going through in terms of the inflammation that your muscles are experiencing, because that has a role in recovery, that can disrupt sleep. So you really do have to appreciate the entire context of recovery to really understand where sleep fits in that. And so tell me about napping, because I know that was a big area that you mentioned about your research that you did earlier on. So we had a question the other day from an athlete about napping and whether this can make a meaningful difference to your kind of the more physical components of your performance. My answer was actually that it's probably more about the mental components of performance. So performance would be either your physical performance, your cognitive performance, and your emotional performance. What was your answer? What do you think, Luke, about napping in athletics and competitive athletics particularly?
Yes, napping is again, it's something that's been popularized in high performance sport. Obviously terms like the power nap and things like that have been coined, and they've been adopted in high performance sport as something that can be performance boosting. So by having a short sleep in the afternoon or before a competition, for example, you can boost your levels of alertness and your energy levels, and you'll be sort of optimized and ready to go prior to a competition. When it kind of falls down a little bit is when we start to look at individuals, and yes, it can have an impact on performance if scheduled appropriately and the individual is familiar with napping and they've got a very good rationale as to why they are napping, which is often forgotten. So napping is something that when you look at the individual, not everyone can do it. So one of my research studies was basically looking at this concept of an athlete's ability to fall asleep. So it was basically, we coined it, I think, sleepability versus sleepiness. Like, what's the reason why an athlete can fall asleep? Because a lot of programs of in high performance look at like regimes of napping whereby they almost schedule naps in the daytime. So like athletes actually have blocks of time in their camps, in their calendars, where they can actually get encouraged to go for a sleep. But when you speak to individuals and we do the tests that we did, which is pretty much putting athletes in a dark room and saying, right, fall asleep, and we wired them up with like PSG or polysomnography and measured like their brain waves and tried to identify like the stage of sleep in which they've fallen asleep. We actually noticed quite quickly that not every person can do this. Like, not everyone has this innate ability to fall asleep on demand. So when you talk about these regimes of like recovery and napping get put in place, it kind of falls down for the individual, because sometimes that can be not useful if like a nap is encouraged or it's prescribed even. And if you're an individual who can't nap in the daytime just because you haven't got that ability to fall asleep, or that your arousal system is such that in order for that to be overcome, you need really high levels of sleepiness to be able to fall asleep in the daytime, means that like an individualized approach is needed. But yeah, there's very much, like, to answer your question, Dave, there's definitely like a strong narrative in sport that napping is very beneficial for performance, but if handled inappropriately, and for example, if naps are taken too close to performance, or they've slept for too long, for example, these sort of factors can start to play in and have a negative impact on performance, whereby you can wake up and you experience these really intense feelings of grogginess, which we call sleep inertia, which can be carried over into the performance. So usually, like, rules of thumb around napping are keep it short and keep it early, in order to sort of stay away from that. But easier said than done, I think, is the last remark on that.
Yeah, so sleep inertia, for anyone, so you may well be aware that sleep isn't just one state. It's broadly divided into two. One is REM, which is your vivid dreaming sleep, which you might have heard of, and the other one is non-REM. And non-REM is further subdivided into three. So 1 and 2, non-REM 1 and 2 are both types of light sleep, but non-REM 3 is the really deep sleep that you need to feel refreshed in the morning. But you actually usually fall asleep into light sleep, N1, N2, work into N3, and then work your way out, have REM, and then that's what you call a sleep cycle. So the reason people say fall asleep, or if you're going to nap, do it for 20 minutes, is because you'll still be in light stages of sleep. If you go beyond 20 minutes, you risk going into deep non-REM 3, from which point, if you wake up, you feel like a zombie. And if your idea about napping is that you want to be alert and fresh and full of beans, then if you wake up feeling like a zombie, that's the opposite of what you wanted to do. And so napping is always worth just double checking what people understand by napping, because sometimes people actually are thinking about sleep, like an actual sleep. And that is sometimes more an expression of inadequate overnight sleep rather than a kind of pep up boost that you can have during the day. But no, it's true. I agree. So that other aspects that we talked to, one was actually talking about in a training camp where everyone seemed to go off for a nap in the middle of the day, and she couldn't nap, so she was not a person who was able to nap. And there was undeniable feelings of inadequacy, that her view was that this is how an athlete should sleep. And people have wacky ideas about how an athlete should sleep, but really the way that you should sleep is absolutely how you should sleep. It's an individual thing. And I think that, was it Roger Federer who was it 12 hours he used to sleep for? I mean, if you were to model yourself on that, I mean, how are you going to get the rest of your life in? When are you going to train? So you have to make sure that it's an individualized approach for sleep. Another thing that we find in athletics is use of sleeping tablets. And again, this probably, I don't know what your views are, Lee, but I think this probably emerges through that overemphasis of the role of sleep in recovery, particularly with footballers playing evening games, that you're finishing quite late, still quite pumped, particularly if you train with other supplements, things like caffeine, that you can't actually get to sleep, but you have that pressure to sleep, so you've recovered properly, so you resort to sleeping tablets. But what's your view on, are sleeping tablets good or bad in a recovery context?
Good question, Dave. I think you might be better qualified to answer your own question, but I'll give it a stab. Sleeping tablets is a really interesting one. I think the reason they're used in high performance contexts are generally quite acute in nature. They're quite in response to a particular challenge, like as Dave alluded to there, and sometimes the feeling that someone needs to seek an external aid to sleep is one, because they haven't got confidence in their own ability to sleep, and two, they're not comfortable with the experiences of sleep disruption when they occur. And those 2 points are really important to consider, and it's something that we try to install in our education with athletes, because essentially that is sort of the goal of any sort of sleep education program. But the role of sleeping tablets in that can be quite demonized in that sense, as in no athlete should take a sleeping tablet ever, because they're really bad for you, and there's like a real problem with sleeping tablets in professional football, blah blah. These are sort of headlines that sort of make the back pages on occasions, but they probably do have a place. Like they do, and I don't think they're all bad, but they just need to be handled with care and probably given in the right context to the right individual, and shouldn't be really seen as as something bad, but equally something that is like a go-to as such. Like, once everything's been exhausted for an individual, then yes, maybe, but there are lots of different things that sit above that, sit before pharmacological aids, that can probably be far more effective, really. But again, it's very easy to reach to something external, because it is a quick fix. But as we know, with most things, nothing's a quick fix. Yeah. But yeah, you might be able to say more, Dave.
No, I mean, that's pretty much the same with sort of non-athletic context. That NICE do advise sleeping tablets, or allow sleeping tablets in short-term insomnia. So it does have a role, absolutely does. And we always like to avoid kind of blanket rules or absolute rules in sleep and large parts of healthcare, because it doesn't really appreciate the individual nature of healthcare, that you have to be person-centered on your approach. Stepping away from elite sport for a moment, stepping away from performance more to fitness, there's been a big push really recently, not a push, but a trend in things like gym going or more amateur athletics. Is actually one of the main motives that people do that is actually for well-being and longevity, rather than performance, rather than gains, however you want to maybe term the more competitive size of that. And this is another really big area for sleep. So sleep works very much hand in hand with fitness. If you think about the reasons why people seek fitness. So if you want to improve your cardiovascular health, sleep is really important in this. That if you sleep for, let's say for argument's sake, roughly a third of your life, then when you're in sleep, you're in a state where your blood pressure is lower, your heart rate is lower, you're in a state of relative cardiovascular respite. And so if you're habitually missing out on sleep, you're habitually missing out on this period of relaxation. So the natural processes of arterial furring up and so on will be accelerated. So that explains why there is good data that if you are habitually short sleeping, that you are at higher risk of things like high blood pressure, heart disease, stroke, and so on. And these are the things that people want to avoid by going to the gym. And similar with things like diabetes. And then the other area would probably be mental health, which you mentioned at the beginning, Lee. But with sleep, there is also a bi-directional relationship between sleep and mental health that we've known for a long time that conditions like depression and anxiety can disrupt sleep. So anxiety can make it quite difficult to fall asleep. And depression famously causes early morning awakening, not all the time, but it quite often does. But there's a lot of evidence now that it actually works the other way. And if you're not sleeping well, that it can actually cause mental health problems. And the issue is if you have both are a cause and effect of each other, that you can set up a cycle where these things escalate quite rapidly. And this is why sleep is really important, and for the reason that people often go to the gym to either improve or maintain their mental health. So it's really across the board, from high performance and elite competitive athletics all the way through to someone who just goes to the gym a few times a week just to improve their health, that sleep is absolutely vital. And this is why as a clinic we are quite bought into the idea of this triad of health, that it's training or exercise, nutrition and sleep. And actually if you're trying to improve someone's well-being, it's quite difficult to do that unless you're addressing all three parts of this pyramid. And on that front, Luke, if you had to pick, I don't know, is 5 too many top tips to sleep better, what would you say?
Oh God, you're on the spot now, Dave. I'll give you 3. Yeah, why not? So I think the first one is to understand the relationship with your sleep. And that might sound a bit wishy-washy, but I'll unpack it a little bit. But what I mean by that is everyone sleeps, and everyone has their own way of sleeping in their context and in their circumstances. And as Dave alluded to, it's very easy to get caught up in those ideologies of what good sleep should look like and the effects of poor sleep on daytime performance. And that's not the same for everyone. And the biggest challenge really with a lot of the work we do is trying to empower athletes to be their own sleep scientists and basically explore their sleep in ways whereby when it is challenged, what do they notice about themselves the next day? What do they notice when they train, when they just live their daily lives? What changes about them? Because not everyone experiences sleep deprivation in the same way. Not everyone will have the same experience of the impact of poor sleep on performance, on their cognition, on their emotional state, and even on their mental health. Everyone's different. So I think it's really important as a first port of call is to try to go about understanding that. And that's a lot of the work we do here at the Better Sleep Clinic, is to give people the tools, enable them to do that. So you can kind of get someone who's quite aware of their sleep or in tune with their sleep. And that puts people in a good place really when you're sort of looking forward.
And that's also another way that sleep's quite distinct from other areas of fitness, because it isn't prescriptive in the same way as, say, nutrition would be, or training. That you couldn't have a disciplined personal trainer, that you couldn't use that same approach for sleep. One, because if it introduces stress and worry and anxiety that you're not going to sleep, but also it doesn't take into account the fact that people are so different with respect to sleep. And probably also wearable tech at the moment, I don't think it's probably quite personalized enough. And there's various issues around accuracy of some of the metrics that it produces. But certainly when it will tell you that tonight you need 6 hours and 33 minutes of sleep, that's probably not personalized enough. You got 2 left.
The second one from that would be to understand that sleep is special. I'm kind of like building on what Dave said, I'm cheating a little bit. But I think there is a lot to be said about that. And when we talk about sleep in comparison to other forms of health and fitness, it's quite easy to see how it is special and different. So, for example, we know by just by worrying about your hydration status, for example, doesn't make you hydrated, but dehydrated, sorry. But worrying about your sleep can impact your sleep. So in that regard, it's different, and it requires a different approach. And also, we know that when we look at how we measure something to do with sleep, it's a really difficult thing to measure, really, because we have no real direct experience of our sleep. We indirectly experience the effect of sleep on the next day. So we don't really know what happens in our sleep. Like from an experience level, we just basically fall into a state of sleep which is arguably unconscious, and then you wake up again and you go about your day. And that in itself is different to other forms of fitness and health, whereby those things are a bit more directly experienced. And then the most special aspect of sleep is this concept that it's passive. It's something which is you can't really force it. It's something, even in the phrase fall asleep is passive. It's not like jump asleep or anything like that. So a lot of the challenges that come with sleep is that it's trying to embrace that and sort of work with it, as opposed to something that, for example, in the gym, for example, putting in more effort usually leads to sort of better sort of short-term outcomes. But with sleep, putting in more effort doesn't lead to better outcomes. In fact, it probably does the exact opposite. So treating it as something as passive. So what I'm trying to say then in a long way is that trying to understand the qualities of sleep and the characteristics of sleep, or the mechanics, as Dave's called it, is probably that next layer above. And understand. And if you can understand how it works, you can understand how it goes wrong. And then, as Dave said earlier, you can start to anticipate these things and learn to be comfortable with yourself when you're not sleeping well in those times, because it will happen.
Yeah, and that's definitely some of the. There are many similarities in how you deal with poor sleep and insomnia with anybody, because behind every athlete is a normal person. But athletes do often have, particularly at the high performance level, do have some characteristics that are relatively common. One is that they are often perfectionists, and also are very much people who like to take action, like to fix a situation, and like to work harder. And that's something that takes a little bit of unpacking with sleep, because, as you say, if you really drive forwards for sleep, you're actually not going to sleep very well. So we always try to kind of nudge someone to 45 degrees. So there's one aspect of CBT for insomnia, which is the gold standard treatment for insomnia. It's called stimulus control therapy, but it's about getting out of bed if you are not sleepy. So if you wake up in the night, don't lie in bed. We're just trying to get people to focus on that. Like, that's what you need to channel your determination into, is making sure you get out of bed consistently every time that you are feeling wakeful in bed, rather than trying to sleep, this idea of sleep effort. So, but to actually understand that there's that 45-degree angle that you need to move on to with athletes can take a bit of extra time. All right, last one.
Last one. I suppose this isn't in any order, but I think the last one is, I think Dave used a good word earlier around this idea that sleep is adaptable. And I think that's probably a really good take-home message, that sleep is inherently good at adapting to the circumstances which it is placed in. And it's sort of designed to be that way. If it wasn't, we'd be in a lot of trouble as a species. It's designed to flex and be something which is dynamic. And I think the way that sleep is presented is something that is static, and it is a certain way. And it kind of relates to my first point, really. But understanding that sleep will wobble, it will change as you age. It will change due to loads of different factors that are fairly societal, really, that we don't have a lot of control over. So even though that socioeconomic status, for example, can have an impact on sleep, gender can have an impact on sleep, who your parents are can have an impact on your sleep. There's loads of things out there that impact sleep that we don't have a lot of control over. And I think how sleep is dealt with at the moment, it is placed on the individual like it's their problem to work with and it's their problem to solve. Whereas I think what we try to do here at the Better Sleep Clinic is try to embrace the complexity of the system of which sleep sits in. And by understanding those sort of bigger moving parts, you can really start to have a greater understanding about the things that are influencing your sleep. Not that you can change them, but you can be aware of them and work with them. So you get to a place of where you're comfortable with your sleep and confident that you can manage it in most situations.
Yeah, I completely agree with that. Also with some of the patients that, again, sort of dragging it back to insomnia, but another perpetuating factor of insomnia is that people don't think that their insomnia can be fixed. People don't think it can be changed. People think that's how it's going to be forever. So you can talk about the mechanics, and you can introduce some experiments that people can do some things, and it's easier to actually get someone to do something that makes their sleep worse. They'll try something and make their sleep worse, and they think, why would they might even actually do the experiment, but they can work it out in their own head. But if you introduce this idea that there are things that you can do that can make your sleep worse, that can change your sleep, then probably there's some things that you can do that make it better. And you challenge this idea that things can't change, just explore why things are the way they are. You probably find there is actually more in your control than you perhaps were aware of. But it all comes from a point of education and understanding, which is what we are massive fans of. Brill, that brings us up to just over 30 minutes. Does anyone have any questions? I'd be very happy to answer any. You can put them in the chat, or you might be muted, but you can definitely put them in the chat. Okay. Well, thank you very much for joining. We've got a few more webinars planned, and we have a few more bits of content coming out. So do keep your eyes peeled. And if you do have a question, do feel free to email us. So you can get us at info@thebettersleepclinic.co.uk. Thanks very much.
Yes, thank you.